Greetings. Today I'm going to talk about can peptides boost growth hormone, HGH. Growth hormone, GH, often called human growth hormone, HGH, plays a central role in the body's development, repair, and metabolism. It regulates muscle mass, fat metabolism, tissue regeneration, and even cognitive function. Naturally, GH levels peak during adolescence and begin to decline with age. This decline has inspired interest in strategies to boost GH production, and one of the most talked about approaches is peptide therapy. Note that the direct injection of human growth hormone has been the mainstay of anti-aging medicine for decades, with many studies showing safety and benefits. Peptides that can enhance your body's production and release of your own growth hormone are the latest developments that may prove to be even more effective. Certain peptides can stimulate the body's own production of growth hormone rather than replacing it directly. But how effective and safe are these peptides? Let's explore what science says about their mechanisms, benefits, and legal considerations. If we haven't met already, I'm the digital avatar of Dr. Max McLeod, aka the Nutrition Ninja Doc, founder of MyBodySymphony.com and ARTC.Health. While he continues to research and explore new and better ways to help his patients achieve their health, performance, and appearance goals, I'm here to convey his knowledge and insights about health, healing, and regeneration. Doc Max believes in using technology constructively to improve efficiency and results. That's why he uses this AI-generated avatar to educate and inform. Before we get into it, please leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way toward helping spread these health-related presentations to more people. Human growth hormone is produced in the pituitary gland, a small structure at the base of the brain. Once released, GH travels through the bloodstream and triggers the liver to produce insulin-like growth factor 1, IGF-1, which promotes cell growth and tissue repair throughout the body. GH supports muscle growth and recovery, fat metabolism and energy balance, bone density maintenance, skin and connective tissue repair, cognitive and emotional health. Declining GH levels are associated with reduced muscle tone, increased fat accumulation, slower recovery, and decreased vitality. All reasons adults explore peptide therapies to rejuvenate these natural processes. Growth hormone-releasing peptides, GHRPs, are a class of synthetic peptides designed to stimulate GH secretion by mimicking the body's natural growth hormone-releasing signals. The most well-known GHRPs include GHRP2, GHRP6, ipamorelin, hexarelin. These peptides bind to specific receptors on the pituitary gland and the hypothalamus, promoting GH release without disrupting normal feedback mechanisms. Unlike synthetic HGH injections, GHRPs do not replace natural GH. They simply encourage the body to produce more of its own. Another peptide category involved in GH stimulation is growth hormone-releasing hormones, GHRHs, and their analogs, such as CJC-1295 and sermorelin. Sermorelin, a shorter peptide that mimics natural GHRH, encouraging the pituitary to release GH in pulses. CJC-1295, a longer-acting analog that can maintain elevated GH and IGF-1 levels for an extended period. When combined with GHRPs, these peptides can produce synergistic effects, meaning the combination can increase growth hormone levels more effectively than either compound alone. The process through which peptides enhance GH production involves both direct and indirect signaling pathways, binding to receptors, GHRPs attached to the ghrelin receptor, also known as GHSR1A, while GHRHs bind to GHRH receptors on the pituitary gland. Calcium and CAMP activation, binding triggers secondary messengers like calcium ions and cyclic AMP, stimulating GH release into the bloodstream. Feedback regulation. The body's natural negative feedback loop, primarily controlled by somatostatin, prevents overstimulation, maintaining balanced GH levels. This natural stimulation pattern helps the body release GH in short pulses, mimicking its normal circadian rhythm, particularly during sleep. When administered under medical supervision, GH-stimulating peptides may offer several physiological benefits: increased lean muscle mass, enhanced protein synthesis, supports muscle growth and repair, reduced body fat, GH boosts metabolism, and encourages the body to use stored fat for energy, improved skin and hair health, collagen production and tissue repair improve elasticity and tone. Faster recovery, enhanced tissue regeneration aids healing from injuries or intense workouts. better sleep and cognitive function, GH pulses during sleep can improve rest quality and mental clarity. However, the degree of benefit varies depending on age, dosage, and individual response. While peptides that stimulate GH can be effective, they are not without risks. Common side effects may include water retention and mild swelling, joint pain or numbness, headaches, temporary insulin sensitivity changes. Unregulated or excessive use could disrupt the body's natural hormone balance, leading to complications similar to those seen with synthetic HGH misuse, such as acromegaly, abnormal growth of bones and tissues. Peptide therapy should only be administered under medical supervision, ideally following blood testing and hormone evaluation. In the United States, peptides such as sermorelin are FDA approved for specific medical uses, like treating growth hormone deficiency in adults and children. However, many others, like CJC 1295, ipamorelin, and GHRP variants, are not approved for human use outside clinical research. They may be legally available for prescription in compounding pharmacies, but recreational or unsupervised use is restricted. Moreover, the World Anti-Doping Agency, WADA, bans GH-releasing peptides in competitive sports due to their performance-enhancing potential. Using them under medical supervision within the context of an observational research study is the best and safest way to use them. We have such a program. Unlike synthetic HGH injections that deliver direct, high doses of hormone, peptides act more physiologically by stimulating natural production. This approach may reduce the risk of desensitization, dependency, and hormonal imbalances. However, results tend to be gradual. It can take several weeks or months to observe visible effects. Peptide therapy aims for long-term restoration rather than short-term enhancement. Peptides that boost growth hormone represent one of the most exciting areas in modern regenerative medicine. By stimulating the body's own GH production, these compounds may offer safer, more natural ways to improve energy, body composition, and recovery. Still, peptides are not magic shortcuts. Their success depends on proper medical oversight, lifestyle factors like proper diet and exercise, as well as legal compliance. When used responsibly, GH-stimulating peptides can bridge the gap between declining hormone levels and optimal vitality, supporting healthy aging without crossing into dangerous territory. As always, reach out for more information about our health enhancement programs, including bioidentical hormone replacement and peptide therapy. Call 941-806-5511.